Day everyone. So this would be our pre-recorded discussion for lesson 1, which is health education with principle and its concept. So for my BSMT2C student, I am Miss Ma'am Nika Blanca Pihana. You can call me Ma'am Pe for short. And we will be having a virtual orientation or virtual general orientation on our next virtual class. I will be introducing myself furthermore to you, and you will be introducing yourself to me. So probably in that day, we will be having a getting to know each other before we will go to our next lesson, which is lesson 2. Okay, so without further ado, let's know first the topics or subtopics behind the course, which is health education with principles and their concepts. So let me introduce to you my outline for today, or the topics that I will be discussing for this day. Okay, for the first one, we have definition of health education, aim and specific objectives of health education, main principle of health education, types of health education, different approaches in health education, and lastly, we will be discussing stages of health education. So today, without further ado, of course, let's start our discussion by defining or by questioning, by asking, what is the definition of health education? I know that when you are listening in this moment, you are currently thinking what is the definition of or what is the meaning of health education. If you have answers, you can leave that in our GC. You can share that in our GC later on. So, with that, let's define what is health education. Of course, health education is any combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitude. To explain it more, health education is one of the social sciences. When we say social sciences, it draws from biological to environmental to psychological and physical, even in medical sciences. Why? Because the purpose of health education is to promote health and prevent diseases. Not only with that, health education also is the combination of learning experiences designed to facilitate voluntary action with a conducive to health. So that was the definition of health education. So probably on promoting health, there is a combination of educational and environmental support. So what would be your work is what would be your work in that time is for you to promote the health education to others. That is why the importance of knowing this one in your field, kasi in the near future, you will be having this kind of work. You will be sharing this kind of work. You will be the one to be an health educator. So with that, let's know who should do health education. Of course, as I've said, since you are one of health workers, you are responsible for promoting health and instituting preventive aspect of care. So not only you, of course, what are those health workers that we have in Philippines? Of course, nurses, doctors, midwives, nurses, let's say the caregiver. It actually promotes a health education. Basta it's includes in the health worker. So literally, you are one of the responsible to promote health education. So with the second slide, any question with it? If you have a question with regards to the definition of health education and to those person that is currently have this responsibility to share health education, you can ask it or you can leave your question in GC. So with that, let's move forward with the next slide. Of course, in a certain course or in a certain topic or course, like I've said, there are a specific goals of it. So as a goals of science instruction, there are at least 3. So number 1 is to understand and apply the methods of scientific inquiry and technological design to investigate question, solve problems, and analyze claims. So with that, you will be following a 6 steps of scientific method. As we all know, I already assume that you've already know the 6 steps of scientific method. So it includes first asking a question about something that you observe. So meaning in that step, you are now observing. You are now giving your observation about a certain process. So second would be doing background research to learn what is already known about the topic. Of course, in the second one, after you have the so-called observation, you will now doing your background research. That background research is pertaining to your observation or to your question that literally created in your first step. Third is to construct a hypothesis. Of course, when we say hypothesis, it is called as an educated guess. So after doing the background of the research, you will be doing your, or you will be guessing. You will be creating an education guess. You will be guessing the certain answer of that, of your observation, of the question of your in your observation. So that would be the third step. Fourth is to test if your educated guess is right or wrong. You will be experimenting, or you will be having an experimentation for you, again, for you to assess if your educated guess or your hypothesis is right or wrong. And the fifth would be after the experimentation, of course, you will be gathering the data, and afterwards, you will be analyzing the data from the experiment and draw your conclusion. And lastly, if all of that is already done, you can now create your theory or fact about the topic or about the process that you are dealing with. So that was the explanation about how you understand and apply some methods or scientific inquiry. So first and foremost of that is you have to follow the steps on scientific method. So you have to know first what is the 6 steps before you can undergo with the process. Okay, for the number 2 goals of science instruction, you have to understand the facts and unifying concept of the life, physical, and earth space sciences. So in this statement, you are probably knowing the relationship or the connection of the physical and earth space science. You will be knowing what are those relationship between the three concept and relate it to the concept of life. So that was the second goals of science instruction. And the third one, comparing or similar with the second one, you have to understand also and connect the relationship among science, technology, and society. So as we all know, these 3 words or these 3 phrases is actually connected. How? By the means of science, we can create technology, and by the means of technology, we can do our work easily, which is being reproduced now in society. So that was the relationship between the 3: science, technology, and society. Science for the concept to produce a certain technology, and technology for doing the work of the human in the society. So technology also give big impact in the economy of a certain country because of the work that has been done with technology. So I hope that you really understand what is the connection between science, technology, and society. We can also connect the humans in the society to science. Why? Because now behind those bars, behind those technology that we will be having, there is so-called humans that being studied a certain technology. Human naman talaga ang gumagawa at tumatapos ng isang work or isang discovery, which is, let's say it is technology. Tao naman talaga ang behind that one. So that's why you can connect the 3 words. You can connect science to technology and society. You can connect society to science and to technology. So with that, if we have no questions, if you have, you can leave again that in GC. So let's move forward now to the next slide. So again, health education, we will be discussing not only health education or the definition of health education, but also with the principles and concept of it. So there's praise with this, or a statement saying that teaching process providing basic knowledge and practice of health so as to be interpreted into proper health behavior. So literally the explanation of this statement is all of the concept will be starting in the foundation, on the basic of it. So literally you have to know first what is health education, or what are the proper way to promote an health, to promote a health, before you can teach it teach it correctly. So before kasi sharing or promoting those health education that you will know, dapat talaga you will know first your foundation, and you will know first the simple steps on promoting health. So that was the explanation behind this statement. So let's proceed again to the next slide. So there is a question here that what are the aims of health education? Of course, health education not only produces concept and principles, but also it produces also what are those aim. Ano ba yung ini-aim ng health education? Bakit ba kayo magpro-promote ng health? Why do you need to share it? Why do you need to promote the health education to others? For, of course, there are so-called three steps. We have in aims of health education, we have health promotion and disease prevention. Okay, by the statement which is said that one of the aim of health education is to promote health and of course disease prevention. So what would be the explanation behind this one? So it literally said that in health promotion and disease prevention, programs are focused on keeping people healthy. Health promotion programs aim to engage and empower individual. So that is the literally, to be specific, that health promotion and disease prevention is literally focused on the program that is actually keeping people healthy. So that is one of the aims of health education. Next is to utilize or utilization of available health services. So literally, it said that in utilization of available health services, it's actually explained that healthcare services or utilization refers to how much healthcare people can use. This type of healthcare can be used in a timing of a certain care that you've eventually sharing. Factors that are influencing healthcare needs include aging. Okay, so literally, to be exact, as I've said, again, it refers to how much healthcare people use. So this is the explanation behind utilization of available health services, and it actually actual coverage of categorized into ambulatory medical care services. Okay, what are those? Either outpatient or home services, either in inpatient or services like in hospital. That is actually the explanation or examples on how you utilize the available health services in a town, in a society. Okay, so the third and the last aims of health education would be early diagnosis and management. Okay, so to explain it further, when we say early diagnosis and management, so it explains on how people, or it helps how people to plan ahead while they are still able to make important decision on their care and support. So literally, it in this statement, early diagnosis is very important. Why? Because the people or the person that having a certain disease is can eventually plan first before undergoing with a certain circumstances, before undergoing beneath with his or her disease, makakaplano pa siya if manlalaman niya or there is early diagnose. So one of the example of early diagnosis is when you have an cancer. Early diagnosis is improved cancer outcomes by providing care at the earliest possible stage. Kaya nga sinasabi ko na mas maganda or in promoting an aims of health education, early diagnosis and management is very important for the person to plan a certain process kung papaano niya or anong gagawin niya sa nangyayari sa kanya, which is she or he having a disease. So it improves actually, lalo na for example your disease and cancer is a cancer, the person eventually know or plan what will be happen next if alam niya na I have disease, I have a cancer. So early diagnosis is very important to provide a care in an earliest or possible stage. Okay? So that is actually one of the important in public health strategy. So if you have any questions with this aim of health education, you can leave it again in our GC. So without further ado, let's move forward for the next slide. So of course, if there is an aims of health education, there is also a specific objectives of health education. There are at least 1, 2, 3, 4, 5 specific objectives of health education. Number 1 is to increase knowledge of the factors that affect health. Second, to encourage behavior which promotes and maintains health. Third, to enlist support for public health measure and when necessary to press for appropriate governmental action. Third, to encourage appropriate use of health services, especially preventive services. Lastly is to inform the public about medical advances, their uses, and their limitations. So, what do you think is the importance of knowing the specific objectives of health education? So one of the importance of knowing the objectives of health education is, of course, it includes providing you as a person or providing you as a person in society a knowledge. Not only a knowledge, it also develop positive attitude towards health issue. And of course, the very important is to promote decision making. So that was the ultimate goal of health education, is to basically promote. And aside from promoting, it is actually to maintain and improve individuals, not only individuals, but also person or individuals in a certain community. Okay, so that was the importance of knowing specific objectives of health education. So please be reminded with these 5 objectives and also know what is the importance of it. Okay, let's move forward to the next slide. There are another question that being stated in the slide. What are the main principles of health education? So let's answer that by knowing with the next slide. Health education main principles is first, supported by the latest knowledge from research. Second, a systematic, comprehensive, and consistent activity. Third, adapted to age, gender, education, and particular health, mental or either mental or social problems of an individual or community. Fourth would be encourages personal investment of an individual. And lastly, to respects environment, culture of an individual. Okay, by these phrases, by these 5 main principle, it literally explains that principle of health education is focuses not only by physical but also in social, psychological factors. Physical, social, and psychological factors all contribute. Lahat yan sila with the 3 concept, all contribute to health. Okay. It explains that the wellness is then expressed through the integration. Okay, your wellness as an individual is actually explained by the integration of the physical, intellectual, emotional, spiritual, social, and environmental components called 6 dimension of health. So that was actually explained by this 5 health main principle. It is accordance to the 3 concept that being connected, which is physical, social, and psychological factors, and that 3 concept actually contribute to your health. So to explain to your health, it's all about your wellness, and your wellness can be expressed through the integration of not only in physical but also intellectual, as I've said a while ago, emotional, spiritual, social, and environmental components. Okay, so that was your main principle of health education. So if you have a question again, you can leave that in our GC. Let's move forward to the next slide. So let's divide the principle of health education. Let's explain it one by one. So we have here the words that you can literally connected by the principle of health education. What are those? We have interest, participation, comprehension, motivation, reinforcement, known to unknown, learning by doing, soil, seed, and sower, community leaders, good health, relationship. So with these words, we can literally explain or we can literally know the work or the process in the principles of health education. So again, isa-isahin natin yan. Let's start with interest. So interest in the principle of health education, how can you possess it? Of course, you will be having by the word interest, you will be having or you will be knowing first what is the topic. So eventually, what is the situation, what is the process in the situation, you will be knowing that one. You will be taking an attention with the certain process. So on how, of course, you will be identifying the felt needs or the needs of the people or the person surrounded by your community or by your society. Then if you are now know, if you give them your attention and you give them your interest, that you will be focusing on what their needs, you can eventually create or prepare a certain program. So that was the explanation on how you give interest or on how you give attention to your persons or people or individual in a certain community or in a certain society. Okay? Aside from interest, we also have participation. Of course, in participation, it's very understandable that you as an educator should encourage people to participate in health education programs. Not only participate, but also created a health education program. In our school, one of the example of it is community services. So probably today, since we are having or since we are suffering from the pandemic or from the COVID-19 that actually surrounded in our country, we cannot have your community services. But eventually, by God's will, if this pandemic is already done, if we can eventually take out this mask that we can have the so-called community service so that you can experience on how you can interact with the person in the society or on how you can promote a health education in the society. Kasi one of the importance yan having or being a health worker So that is very important for you to know or for you to have the so-called or to create or to communicate with the other person or to communicate to the person that is actually stranger to you So literally, it can include as your patient or it can include as your one of your so-called participants in a certain program. So aside from that, not only participated in programs and not only created the programs, of course, group discussion is one of the important also. Group discussion, panel discussion, etc. or provide opportunity for people participation is one of the key to participate or to show that you are now eventually has an interest to create a certain health promotion that eventually can be participated but by not only you but also with the people surrounded by you. Kasi in a health education or in promoting an health education, it's not only you Hindi ka lang mag-isa dyan. You can eventually connected to your CI or to your clinical instructor. Aside from that, your clinical instructor is connected to the institution with the accordance of your classmates or with the accordance of the students that eventually taking a medical course. So that's why I've said that group discussion and panel discussion is very important in the participation, in showing participation. And aside from that, all of that practices or all of that program is actually being processed or being worked if you lead to accept that project or if you lead to accept that program. If you are a willingness to lead or willingness to accept those programs that you will be created, then eventually that project will be work. That program would be work. So, in participation is not only created on making a program, but also in having a communication with the others, not only with your participants, but also with your colleagues. That is very important to communicate with the other, to communicate to the other colleagues that you have, kasi you will be changing ideas on how to promote health education. So, if there is no question, let's proceed now to the next. Of course, aside from interest and participation, we also have known, these statements said known to unknown. Okay, it said that start with what people already know and then give the new knowledge. Of course, as a health educator or as a health promoters, you will eventually listen first what are the problem being stated in the society or in the community. Then afterwards, you will be having a certain solution with the problem, and with regards to that, you can share new knowledge. You can now solve, you can now give the solution of the problem of the participants in a certain community. So that is why it's so called known to unknown, kasi let them give or let them show to you what is the real happening in the community, then eventually give them a certain solution or a certain new knowledge to solve the certain problem. Okay, so by that, with the existing knowledge as people as the basic step. So literally from the problem or from the knowledge that the community told to you, it come from first, of course, with the existing of it. Yun talaga yung pinakauna, with the existing knowledge or knowledge that the people or the person surrounded by the community share to you. Ang idadagdag mo na lang is yung kung ano yung natututunan mo or kung ano yung bagong kaalaman na pwede mong i-share with the community. So that's why community services is being processed or being worked, kasi you are now giving the community a new knowledge. Okay? So without any questions, so you can leave that in our GC. So let's move forward again. The next one is comprehension. It's determine the level of literacy and understanding of the audience. Language of communication understandable to the audience. Usage of technical or medical term should be avoided. Okay, so this comprehension naman will be focusing or will be showing on how you communicate with your with your participant or with the person that is in the community. Of course, in the communication, hindi naman sa communication nyo, you will be sharing a certain medical terminology. Bakit? Hindi kasi nila yan maiintindihan. So as much as possible, you will explain to them how that medical terminology defined in a simplest word. Ganon ang gagawin. Hindi mo naman kailangang sabihin dyan na that today we will be having, then you will be inputting a medical term in that. Hindi. Kasi bakit? Hindi nila yan maiintindihan. Kasi probably in a community services, hindi kayo dito sa city gagawa ng community services. One of my experience in my midwifery department, I think, midwifery course, they actually created or they actually go in Awang, DOS, Maguindanao. Doon sila naggumawa ng community service. And knowing that the people in that community is not a city person. Oh, what do you mean by city person? Meaning, doon sa kabukid-bukiran, doon sila nakikita or doon talaga pumupunta ang mga estudyante para lang bumigay or ibigay yung community service na meron sa institution. Kaya nga, sa comprehension, for you to understand by the person in the community, you have to tell them or you have to explain to them with as much as possible kung anong medium of language or medium communication ang ginagawa nila doon or na sinasalita nila doon ang pwede mong isalita para maintindihan talaga. So that is the meaning of comprehension, or how can you deal with the comprehension. So very ekis, avoid use medical terms kasi hindi nila yan maintindihan. As I've said, just explain it in the simplest form kung ano yung gagawin nyo in a community service. Okay? So now, let's move forward again with the next slide. Of course, after the comprehension, we all have so-called reinforcement. When we say reinforcement, it is also called as booster dose. It refers to repetition needed when not possible for people to learn new things in short time. So reinforcement is actually being shown if the community or the person in the community and you as a health worker is hindi nila maintindihan ng isang discussion lang or isang way. You can repeat what you've said or you can reinforce the idea or you can reinforce the process if the person inside the community cannot understand it. Pwede ulitin, pwede mag-reinforce ng another process, pwede mag-reinforce ng another idea if the community cannot understand what you are saying. Okay? Naintindihan? So again, in comprehension, if they cannot understand you, in a simplest word na nga yung sinabi mo, you can eventually repeat it again kasi kailangan talagang i-repeat for them to know what are your, or the question is, ano ba talaga yung gagawin nyo dito sa community namin? So, para maintindihan ng sobra, hindi lang kailangan ng comprehension kailangan din ng reinforcement kasi for you to repeat what you've said, for you to repeat what you've discussed, kailangan yan ulitin as much as possible kung hindi talaga maintindihan ng community or kung hindi talaga maintindihan ng person behind the community. Okay? Understand? So, I think you can leave another comments in our GC. So let's move forward again to the next slide. Of course, in reinforcement and comprehension, we also have motivation. Motivation is defined as the fundamental desire for learning in an individual. There are two types of motivation. We have primary motive and secondary motive. Primary motive is for inborn or your desire, food, clothing, and housing. That is primary motive. Secondary motive is the outside forces, gifts, a word of praise, love, rewards. That is actually a secondary motive. Okay. So let me clarify it furthermore. So in showing your care to the person in the community, of course there's so-called motivation, di ba? Meron talagang desire of learning kayo in each individual in going in a community service. So, what are your motivation? Of course, in promoting an health educators or being a health worker, you are being motivated to do that because that is your work. Once you've enrolled with a certain course like medical field, alam mo that your purpose in life is to care other people. Not only other people but also with your circle of friends, circle of families. The word would be to care people. So, eventually, if you will be enrolling in medical courses, yan na talaga yung motto mo in life. Yan na talaga yung quotation mo in life that you will be handling. So, that would be your motivation to give them a certain care, to give them the community service that you want. So, of course, in primary motive and secondary motive, we have inborn and desire with that like. For primary motive, pang sarili mo lang naman yan Your inborn, your desire. Ano ba yung gusto mo? What you want? Of course, clothing, basic needs is actually there. For secondary motive, ito na yon, to give back. Ito na yung gagawin mo with the community service, to give back what you have been done being a medical course or to give back to others kung ano ba talaga yung pwede mong maibigay as a health workers. What are those? Not only by giving gifts. Of course, in a community service, meron din kayo talaga yung pa-food, papakain with those children. And aside from that, word and praises. Word and praises is one of the appreciation that can heart be flattered. Yan lang. Words of appreciation is done. And words of appreciation is enough for you or for them to know that there is someone that showing care to them. Parang ganun lang. A word of praises lang, word of praise lang, you can eventually give to your community or to the person in the community. Eventually, they can know or they can feel your love. They can feel your care. So, yan. Yan yung motivation ng principle of health education. So, let's move forward with another slide. Of course, we also have learning by doing. Learning by doing is the process accompanied by doing the new things. Based on the famous Chinese proverb, if I hear, I forget. If I see, I remember. If I do, I know. Okay, from the phrase like this, that if I do, I know, yes. Literally, that is actually correct. Why? In a certain content, you can do a certain content if you know the content, right? Yung content or your fact or what is being said in the content, you can literally apply it to the real world. Tama ba ako? Opo, tama. Kasi how can you do a certain learnings kung hindi mo yun natutunan? Or how can you do a certain proper wealth, proper health promotion if you did not know what is the background of promotion, of health promotion, right? So, literally back to basic na naman kayo. You have to learn first how to promote health. You have to learn first what is the work of health education before you will be going to do that one in the real world. So I hope you understand what is learning by doing, by basically going back to the foundation, or basically knowing first how to promote, how to deal, or what is the definition of health education before you will do the certain, or before you will apply it to the real world. Okay? So let's move forward again to another slide. We also have soil, seed, sower. Okay, what do you mean by this? Let's explain it one by one. Soil. Soil is people to whom education is given. So who are the soil? People to whom thou, or this soil is eventually show, or this soil are those people that given, or to whom education is given. Seeds, health facts to be given. Sower, media to transmit the facts. All the components are interdependent and result in dynamic interaction. So soil, seed, sower is connected, has a relationship with each other. Why? Because soil is the person or the people to whom education is given. And seed is the health facts, or the content of the health education that is being given to the soil, which is the people to whom, which is the people that actually know the education behind of it. And lastly, the sower, or the media to transmit the facts. So this three is eventually connected by their function. Soil is the people, yung taong ang merong daladalang education na ipapamahagi. Seeds ay yung content, kung anong meron doon sa health education na ibibigay doon sa soil or ipapamahagi sa pamamagitan ng soil or yung people na nagpapamahagi naman ng health education sa bawat isa't isa or sa bawat tao. And yung sower naman, through media, social media effects, organization in a social media and organization in different platform can actually transmit those content, those seeds, and those education that from people or from person pwede ipamahagi or pwede i-transmit via media or the different platform called sower. That's why I've said that soil, seed, sower is connected, has a relationship with each other. Okay? Let's proceed. We also have good human relation. Of course, this is very understandable and fact. Health education should have good personal qualities. Yes. Should be able to maintain friendly relations with people. Should have a kind, not sympathetic attitude. Opo, tama yan. Good human relationship. Why? Kasi you will dealing with a stranger You will dealing with a person in the community na hindi mo kilala. So how can you give a sympathy kung wala kang nun? How can you give me a care kung wala ka nun? So basically, if you're a medical worker, or if you are a health worker, dapat innate sa'yo, or dapat you have to learn how to care stranger people. Kasi ang hirap kasi sa atin with this modern life, or with this modern situation. Lagi lang tayong may bibigyan tayo ng halaga or lagi tayong magbibigay ng halaga kapag kakilala natin. Oo, totoo naman yan. That is to be honest, totoo naman yan. Even me, I experienced that one that yung pinakauna mong bibigyang halaga is yung kakilala mo, kaibigan mo, parte ng pamilya mo, girlfriend, boyfriend, your partner, your husband or wife, but eventually you will not know that even stranger can give care. Meron pa ring mga good Samaritan nowadays. For example, by helping a old woman to cross the street, you are being called good Samaritan eh. You are being called has a sympathy with that old woman. So as a medical worker or as a health worker, you have to learn how to care to the stranger person or to have to care to the other people. Okay? So now, let's proceed. Community leaders, of course. Leaders can be used to reach people of the community and to convince them about the need for health education. So being an health workers, you are being now a leader. Why? You are now creating a group. You are now creating an organization to produce a program to give a beautiful process or to give a good process that can be benefit not only by you as health workers but also by the society or by the community. Hindi lang naman ikaw ang magbe-beneficio niyan eh. Pati rin yung community. The community is the very important. Yan yung unang-unang gagawin mo. The community will be benefit the program that you will be dealing. So, in being a health workers, you are being a community leaders. Okay? Let's proceed to another slide. Of course, so that is actually the end pala of the main principle or the principle of health education. So now let's go on the competency base. So a competency consists of one or more skills whose mastery would enable the attainment of the competency. A competency is linked to all three of the domains under which performance can be assessed: knowledge, skills, and attitude. Possessing a performance dimension, competency are observable and demonstrable. Since competencies are observable, they are also measurable. It is possible to assess a competency from a teacher performance. So, competency naman for the health education, competency base is dealing on how you teach or how you promote health education. So, eventually, competency base is being shown in your teaching performance. Teaching performance. So, let's set aside the community service that I gave you an example. Let's go back to your teaching on how you will promote or how you will share the idea or the knowledge about health education. So competency based, the domains would be knowledge, skills, and attitudes. Since we have skill and attitudes that being shared to the community service that we have, of course, knowledge. Before you will go naman with the community service, you will be dealing muna on how to create or how to make the community service, on how to deliver those content that you have to tell to the person. So, kailangan ganon. So, saan makikita ang competency base? Doon muna sa content, doon muna on how you perform your teaching base. Diyan muna natin makikita bago mo i-apply to real world o bago mo i-apply to the community. Okay? So, I hope you understand. If you have a question with this slide, you can leave it in our GC. Next would be the 21st century teaching competency. Of course, if we have a competency base, we also have this, we have to know the 21st century teaching competency. What are those? Number 1, teachers demonstrate leadership. Of course, teachers lead in the classroom by evaluating student progress using a variety of assessment, data measuring goals, drawing on appropriate data to develop classroom and instructional plans, maintaining a safe and orderly classroom that facilitates student learning, and positive management of student behavior, effective communication to diffuse and de-escalate disruptive are dangerous behavior and safe and appropriate seclusion and restraint techniques. So, the very first one you will be knowing in teaching competency is to be or to demonstrate leadership. How can you do that? Of course, being a leader or being a captain in a boat, you have to show the leadership or you have to show a command. So, in a teacher base and a student base, meron pa rin tayong so-called relationship, right? We can eventually have the so-called sister relationship, motherhood relationship, but do not forget that you are the captain. Do not forget that you are the leader of the boat. So meaning, meron pa ring limitation. There is so-called limitation in your relationship. Being a leader will show you how to command, how to evaluate the variety of aspect or attitude of a certain student. Kaya there is a limitation that. Kaya nga sinasabi, you are the captain of the boat. If you did not know how to do your job easily, or you do your job or work, if you did not know what is your work, eventually your boat will be sinking. Right? Lulubog yung boat mo. Kapag yung captain hindi niya alam kung paano i-process kung anong nangyayari sa classroom. Let's say, for example, your classroom is your boat. You will be the captain. Then the constituent or the people in the boat is your students. So if the student will have this so-called kung sila yung mas masunod kaysa sayo, eventually lulubog yung barko. Bakit? Kasi the captain did not work or the captain did not hindi niya nagawa kung ano talaga yung role niya. So as a leader, you have to be as a teacher, you have to be a leader. Okay? So next to that, teachers demonstrate also leadership in the school by engaging in collaborative and collegial professional learning activities, identifying the characteristics or critical elements of a school improvement plan, and displaying an ability to use appropriate data to identify areas of need that should be addressed in a school improvement plan. Of course, not only ang daming of course si mama. So, not only by, your leadership cannot be shown not only in the classroom, but also in the institution. You can be leader in a certain institution by dealing what? By engaging yourself in a self-activities, by engaging yourself with the trainings in a medical field. Once you are a clinical instructor, you will be dealing with the medical trainings. What are those? We have Red Cross here. Yan, yung mga trainings na ganyan, papasukan nyo lahat. So, again, not only in the classroom, but also in the institution itself, but also in the school itself, you can have or you can show your leadership. Okay? Let's, next slide. We also have this teacher lead the teaching profession by participating in professional development and growth activities and developing professional relationship and networks. Teachers advocate for schools and students by let's explain first the letter C. Teachers lead the teaching profession by participating in professional development. Okay. So teachers can be shown in a teaching profession once you can eventually give your development, or once the professional development of your as a teacher can be shown. On how? It can be shown with the different activities in the institution. It can be shown in the classroom itself. By dealing or by working it professionally, you can eventually give them that, or you can eventually show to them that you are developing in your profession. Yan. So that was the explanation for letter C, which is teachers lead the teaching profession. So let's now go with the letter D. Teachers advocate for schools and students by implementing and adhering to policies and practices positively affecting students' learning. So how can teacher advocate for school and student? Of course, by implementing such a rules and regulation simply in the classroom. Teacher can formulate rules and regulation. Even me, right? In my general orientation, it focuses on the getting to know each other. Afterwards, I will be dealing or I will be explaining to you my rules and regulation. So that is a very important to lead the limitation of the relationship between student and teacher to have the so-called rules and regulation. Rules and regulation will simply explain the wall of your relationship. Okay? And lastly, teacher demonstrate high ethical standards. Okay, teacher demonstrate ethical standards, yes. On how? By doing, by referring it to the code of ethics that the teachers has. Of course, in the medical, you have code of ethics, right? If you can implement it, if you can show it to others, so then eventually you are demonstrating your ethical standards. Kung yun na nga, how can you give that one? How can you show that one to others if you did not know your code of ethics? So literally in any other processes, dapat kailangan ang una talagang kailangan na matutunan ng isang person that have a career, kasi all of a career has a code of ethics. Dapat yan yung unang-una nyong matututunan. Your code of ethics or your ethical standard. Okay? Let's proceed to number 2. Number 2, teacher establish a respectful environment for diverse population of students. It said that teachers provide an environment in which each child has a positive, nurturing relationship with caring adults. Teacher also embrace diversity in the school community and in the world. And teachers treat also students as individuals by maintaining a learning environment that conveys high expectation of every statement. Okay, so in this statement lang, in this side, isa lang talaga yung kailangang explain dito. What are those? It said that teacher can be or teacher will lead the student in a quite wonderful learning, or can give a wonderful learning, best learning, if of course the environment is conducive for learning. So that is very important again. Dapat your classroom, dapat your institution is conducive to learn. How? So literally by showing that that environment is safe, for the student, that environment is actually being a sanctuary of the student that can eventually know, alam nila na safe sila doon, na ito yung sanctuary nila to learn, walang ibang chaos, there's no distraction at all. So that was the explanation behind this slide. So let's go with another slide. Teachers adapt their teaching for the benefit of students with special needs by cooperating with specialists and using resources to support the special learning needs of all students. Yes, teachers work collaboratively with families of students and other significant adults by communicating and collaborating with the home and community for the benefit of the students. Yes, it's actually being discussed. It's actually being work or process in if you are a teacher or if you are a clinical instructor. Why? Because being a teacher or being a clinical instructor is a heavy job. Why? Kasi you are a slash mother. So you have to communicate also what is happening about your student. You have to know the background of the student. You have to know also the background of the family for you to assess kung bakit ganyan yung bata. Kung bakit may mga problem, bakit pumapasok siya sa paaralan na hindi interesado sa kung anong meron ang binibigay mo. So that is the very important for you to give the parents assurance that na alam mo kung anong nangyayari sa estudyante mo. So you have to need to be access, or you have to give your communication or conversation with the parents. Okay? So if no more question with this slide, let's proceed to another slide. Okay, for the next 21st century teaching, of course, it said that teachers know the content they teach. Yes, that is very important. Like me, before I will start my lesson, or either before and after I will start my lesson, I actually read, I actually know how to study it first before explaining it. Yan. Kasi yan yung parte ng pagiging teacher eh. Yan yung parte ng pagiging clinical instructor. You have to learn, you have to know first the content for you to share to your student. Kasi ang mangyayari, if you did not know what is the content at all, you cannot share it or you cannot explain it smoothly. What do you mean by smoothly? You cannot explain it in a summarization or summarized words. So, literally, the teacher first know the content, or the teacher first should have the content itself. Meron na dapat talaga siyang content, dala-dala sa sarili niya, for him or her to share it to share it to the students. Kailangan talaga, even though you did not study, kung alam na ni teacher yung content ng subject niya, eventually, it is very, normal to the teacher to teach. Kasi, that is our job. Learning is our job. Teacher is it's actually a vice versa of learning. Lagi na lang yan. It's paikot-ikot. Hindi kami natatapos to learn or to study certain topic or to study certain discoveries or theory because we are a teacher. Our job is to inform you with the knowledge that you did not know. Kaya yan talaga ang kailangan namin to know that dapat alam namin ang content, that we have to know the content before we will dealing with you guys, before we will discuss with you guys. Okay, so that is the job of being a teacher. Next, teachers facilitate learning for their student. Of course. Again, madaming of course si ma'am. Sorry with the abusive term or abusive use of course. Okay. So, teachers facilitate learning for their students? Yes, kasi how can teachers show that one? By the ways in which learning takes place and appropriate levels of intellectual, either physical, social, and emotional development. So, in facilitate learning, teacher is not only focusing by the emotional or the intellectual part, teachers also facilitate your emotions. Teacher also facilitate your social or your communication with the others. So hindi lang natatapos to give you an knowledge, but also to process or to manage your emotions, to manage your socialization with the others. Yan din ang unang ginagawa or unang binabahagi ni teacher sa kanyang mga estudyante. Okay? Let's move forward to the next slide. Teachers display their awareness of technology potential to enhance learning. Teachers help students grow as a thinking individuals. Yes. Teachers help students to work in teams and develop leadership qualities. It's actually being discussed kanina. Teachers reach their students best. And teachers best assess what students have learned. Oh, yes. Okay. So it said that teachers display their awareness of technology potential to enhance learning. So, in this day, of course, we actually having an online class or an online virtual class. This is the alternative one for the face-to-face discussion. So for this one, the teacher is actually give you an awareness on how to use a potential technology. So from using our platform, which is eClass, the teacher, me, itself is actually give you an information about how we do the e-class, how we do the platform. It's very techy na ngayon nowadays kasi you can eventually answer an assessment in the computer. You can eventually get your lesson in the laptop, in your technology, in your cell phone, right? So napakadali na lang ngayon. So that is actually the job again of the teacher to give you an awareness what are those possible technology that we will be having or we will be using along the way in the class or along the way in the lesson that actually having or being shared by the teacher. Okay, teacher, it said also the teacher help student grow as a thinking individuals. Of course, yes, thinking individuals on how by the interaction between the student and the teacher. Teacher help now how the student grow kung paano silang mag-isip. Kasi by throwing questions, by giving their some questions assessment, you can eventually assess or you can eventually give them a hint on how to think correctly or how to how to make this so-called critical thinking. Kung paano nila gagamitin yon, na napapamahagi mo na yan by the means of what? Question and answer, oral recitation, and of course, assessment. It said also in this one that teachers help students to work in teams and develop leadership qualities. Yes. On how? In the peer group or group participation. Meron tayong sinasabing activity in our face-to-face. Always, I will be always giving a group activity yan. By having a group activity, the student literally share their ideas to the other student or to the other peer. So by doing that, the idea of the student can be grow by sharing and adopting the idea that coming from the other student or to their peer. Yan lang yon. So the next one, it said that teachers reach their student best. Yes. How? Of course, by using or communication. Nowadays, teacher and student communicate by the means of group chat. How? In Facebook and different platform like Facebook. Siguro Facebook is the best platform or communicating your student. Wala pa kasi akong naranasan that the teacher communicate in IG. So possible the best platform to communicate with the student is the Facebook or the Messenger. And lastly, teachers best assess what students have learned on using multiple indicators. Of course, yan na ba? Sinasabi ko, formative and summative assessment. We can eventually assess as a teacher kung ano yung natutunan nyo or if you have learned with a certain discussion. Yan yon. That is how can we assess you as a student. So now let's proceed to the next slide. We have teachers reflect on their practice. Teacher analyze student learning by using data to provide ideas about what can be done to improve student learning. Yes. Teachers link professional growth to their professional goals by participating in recommended activities for professional learning and development. Teachers function effectively in a complex, dynamic environment by using a variety of research, verified approaches to improve teaching and learning cited in number, of course, in a certain explanation. In this situation, teachers reflect on their practices. It is along the way on the lesson, on how the teacher grow day by day, on how the teacher eventually share to you their knowledge, kung paano ba nila, kung paano yung iba't ibang strategy, yung different strategy that the teacher uses that can reflect. Yan na yung pwede nilang i-reflect sa practice na ginawa nila last time to be connected to the practice na gagawin nila today or today or kung saan pa, kung sa susunod pa na mga araw na nagagawa sila ng lesson, or they will be sharing their ideas to you, or they will be sharing the topic to you. So that was the explanation about this. Teachers reflect on their practices. Okay. It also said that it's linked professional growth to their professional goals. How? By participating in recommending activities for professional learning and development. Okay, like I've said, how the teacher grow their professionalism or their being professional by the means of the activity. By doing it or by socializing it to the different activity in the institution, makakapag-show yung teacher ng professionalism niya. Go-grow at magde-develop ang kanyang professionalism by the institution itself because of the activities that they will be going to do or they will be going to work. So that was the 21st, okay, that was the 21st century teaching. So I hope you understand my discussion. So any questions? If you have questions, clarifications to this discussion, you can leave that in our GC. So I am happy and very amazed to entertain that one to your question if you have. So if no more with that, thank you very much for today. I hope you listen it again and again so that you can understand the topic. So thank you very much. God bless everyone.